On ultrasound, the ovary appears ovoid, like a chicken egg, and is located on either side of the uterus. It has a soft, slightly grainy texture, different from surrounding tissues. The appearance and size of the ovary vary with the time of the menstrual cycle as well as the woman's age. One of the most important features? Follicles, which are typically numerous in reproductive ages. These look like small, dark, black circular spaces inside the ovary. Each follicle contains an immature egg that is before ovulation, where one follicle grows larger. This is the dominant follicle and prepares for ovulation. After ovulation, the ovary may show a structure called the corpus luteum, which can look more complex or slightly irregular compared to simple follicles. Sometimes ovaries can appear different, like having many small follicles, as seen in conditions like polycystic ovary syndrome, PCOS. The most optimal approach to assess the ovaries is transvaginal ultrasound. It allows for the best resolution. The transvaginal ultrasound should be performed on an empty bladder. The transabdominal approach, which is used when the TVS is not feasible, is limited due to lower resolution and the presence of bowel loops, which often shadow the ovaries. That's why it's performed with a full bladder for optimal visualization. Sometimes the ovaries may not be identifiable. This usually occurs prior to puberty, after menopause, or in the presence of large fibroids, which shadow the adnexal regions. In case of hysterectomy, the ovaries are typically more difficult to image because the bowels fill up the space of the removed uterus. The normal fallopian tubes are not identified as separate structures on ultrasound unless they are with pathology. Here are some common pathologies that make the tubes visible.